Hi everyone, my name is Carrie Geis and I'm an instructor here at UMA within the Medical Administrative Assistant Medical Office Billing Specialist Program. I'm here with a lesson to better help you understand this week's content. This week, we're going to discuss the understanding of the barriers to therapeutic communication as it relates to multiculturalism and understanding different cultures and diversity. This week, we're going to talk about the why. In this lecture, we're going to talk about the why. Why do we need to understand in relationship to therapeutic communication? What is a definition of a culture? What does it mean to be culturally diverse? What are the cultural characteristics that are important in healthcare, more specifically related to healthcare, as this is what this course focuses on? And we're going to talk about how do we develop multicultural communication, as well as understanding what are the barriers that exist to multicultural communication. We can't overcome those barriers until we recognize what those barriers are that do exist. The why. Okay. Why must we demonstrate a respect and understanding of differences and to provide effective care to patients? Well, over a third of the makeup of our country is from different cultural backgrounds other than just American culture. We encounter these people from a variety of different backgrounds every day within all of our interactions. Could be on the phone, could be on the internet, could be in the store, could be in school, could be anywhere. We encounter people of diverse backgrounds. Sometimes we don't know they are. I want to provide you an example as to why I feel like it's important in my field as a speech pathologist who focuses on doing feeding therapy with families. It's really important for me to understand what some of these other families, some of their, say, dietary restrictions or their rituals or variety of things such as cultures, family cultures and values when I'm making recommendations for families. I don't want to make a recommendation for a family to serve their child meat if he's a picky eater, if the family will never eat meat because they're vegetarian based on their culture. There's a lot of cultures out there that do have dietary restrictions. Lots of cultures of some of the Indian descent don't eat meats. They rely more on lentils and beans and more whole grain. Also, who do we address? Do I talk to mom? Do I talk to dad? Do I talk to grandma? Who in the hierarchy do I need to address? On a daily basis, this is what I'm actually dealing with. Culture. What is culture? We have to understand what culture is. It's a shared way of living by a group of people. So what makes up someone's culture could be their shared religions, their shared belief systems, shared values, what's important to them, or certain manners important to them. What do they value? Maybe they value meal times or family get-togethers versus some cultures might be more for, say, friends. Different languages make up different cultures, different traditions, what holidays they celebrate or what holidays they don't celebrate can make up a specific culture. Manners. A great example would be this. In some cultures, it's very important that you say yes, ma'am, no, ma'am, yes, sir, no, sir. And then some cultures don't find that as important. So if you don't find it as important, one does find it important, they could be offended by it, but having to understand that different cultures have different ways. And certain objects that make up certain pieces that are important, and those things can be passed down from generation to generation. Important to understand as well is that within each race, there can be many different cultures. So it's important to remember that we don't look at one race and think that they have all specific cultures, because that's not necessarily true. For example, I could use a particular neighborhood. It might have 5 houses on the same street that have 5 different families living in those homes, all made up of the same race, but you might have 4 to 5 different types of cultures living within that same street. So these are some things to keep in mind that these, as we'll talk later, can be actual barriers. Also, so what it means to be culturally diverse. Another term that's used interchangeably would be multiculturalism. And what multiculturalism and cultural diversity is what makes up what's around us. So I found this great article, this summary and explanation by Caleb Rosado, who's a sociologist out of Eastern University, who explains multiculturalism perfectly in what I believe is a perfect explanation. And this is: multiculturalism is a system of beliefs and behaviors that recognize and respect the presence of all diverse groups in an organization or society, acknowledges and values their sociocultural differences, and encourages and enables their continued contribution within an inclusive cultural context, which empowers all within the organization or society. I felt like this was a great explanation of what it means to live in a culturally diverse society. And I wanted to point out some key terms that I really found were important to identify what it means to live in culturally diverse society. And that means we have to recognize and respect those diverse groups. We have to recognize and respect that they're there. We have to acknowledge and value that we all have differences and value each other's differences. We encourage and enable, allow all of us to be an integral part of that community, that cultural context, and we empower each other. So we all rely on each other to empower each other. Cultural characteristics that we need to consider. So, cultural characteristics that we might need to, when we're talking about therapeutic communication and healthcare communication, these are some of the things that we specifically really might impact the way you communicate with others that you work with, or patients, or co-work, or referring agencies, whoever it might be. We need to understand that the cultural characteristics of languages, gender roles within those specific cultures, who has, I use the term quote unquote, the seniority within that culture. Is it the male versus female, female versus the male? Some of them have more, I guess you could use the term superiority over the other. For example, had a family I work with frequently, mom and dad would come into all the treatment sessions, but everything had to really be focused on dad, because dad was, in their family or their cultural structure, was the superior person, and dad, it all reverted back to what dad was going to approve or share. And so most of my questioning would go back to that father and mom, if father would allow. I had one time where a mother would never answer a question until she looked at the father to give the okay. I had to be okay with that. Nonverbal communication. This could mean touch. Some cultures find touch as endearing and a way of communicating with each other, and some cultures find it offensive to touch somebody unless asked, or in certain situations they might allow it. Eye contact. This is a big one too, because there are some cultures that find eye contact to be a sign of disrespect. For example, in some of the Asian cultures, it's a sign of disrespect to show extended eye contact to somebody of superiority. But in certain American cultures, it's actually a sign of disrespect to not maintain eye contact with somebody of superiority. Body language. This might mean the way you hold yourself. Arms crossed might mean one thing in one culture, but it might not mean something in the other culture. Family hierarchy. This also goes into family structure, such as who has essentially final say in the family roles, the family structures, all the way from the grandparents, the elders, all the way back down. Use of slang. Well, this one is something that I see more frequently in some cultures. The use of slang, it's more common and not considered disrespectful and common language, where in some cultures slang is considered disrespectful, inappropriate, not professional. And it's important to understand in the environment that you're working in, the different terminology and words that people are using, and when slang is appropriate, not appropriate, and what is considered slang in some cultures might not be considered slang in another culture. Natural remedies. Some believe more and say that folk medicine kind of care versus the use of medications, say Eastern versus Western, before they some prefer to try that natural holistic route before they'll actually turn to, say, a medication route. So some medical professionals, doctors, they need to take that into account, that when you have patients and you're making recommendations, that's some of those things that they take into consideration based on various cultures. As is dietary restrictions. Definitely dietary restrictions. That goes back to the comment I made earlier, is understanding that some cultures don't eat meat, or certain types of meat, or they won't eat pork, or maybe they're vegetarian, or maybe you might even have some that are believe in that, say, a gluten. That might be more of a lifestyle, but not dietary, but it could be more of a cultural type restriction. So when I'm talking to families, I actually ask those questions. What dietary restrictions and why? Is it cultural? Is it choice? Or is it something that's important or not important within you, within your family structure? Especially when I'm working with children who don't like to eat. So, reminder, we're taking all this into consideration when we're talking about therapeutic communication. We're not talking about social communication, but therapeutic communication. And what therapeutic communication is when there's an individual has a need and the other person has the skill set to meet that need. So patient coming to a doctor to get help. It's a very different, it's a goal-oriented form of communication, where social communication might be more open-ended and not necessarily have a focus or a goal. So moving forward, we're going to talk about why it's important to understand the cultural barriers that are associated with therapeutic communication. We need to develop multi-therapeutic cultural communication. Sometimes it's not always that easy. So some of the actions that promote multicultural communication would be, we must be informed about the other's beliefs and values, and we also must recognize what those barriers are that prevent us from forming multicultural therapeutic communication, and then we do need to develop techniques. This week, we're talking about recognizing what those we're going to talk further about recognizing what those specific barriers might be. You can't overcome that barrier if you don't realize that barrier exists. So some of the barriers to multi-therapeutic communication include lack of knowledge. Sometimes just not understanding or knowing that the others are coming from a different therapeutic communication side, a different cultural background, just the lack of understanding. So some ways, and you see it talked about in your textbook, is, looking on the internet, participating in activities of other cultures in your area, learning more about diets or food by going to specific restaurants, or just in general asking questions and researching on the internet will help gain some knowledge about some of those other cultures that you're going to communicate with. Fear and distrust can become a big barrier because sometimes we fear what we don't know. When somebody comes at us and they're maybe wearing something different, or a head garb, or they talk a different way and you don't understand them, just that fear of communicating with them can be a challenge. I had a call the other day with somebody, and it was very hard to understand them because of the accent, and I was getting very anxious and nervous because I didn't understand what this person was saying, and I felt like I should have understood. So I had to put some things in place to be able to overcome that by using an interpreter. But I did get pretty anxious and fearful because I couldn't communicate with this other person. Racism. Racism is big. It could go deep into a conversation, which we won't do here. But what this is it's any kind of racial discrimination based on any kind of physical characteristic. This could be discriminating against not allowing somebody's access to something that others might have, segregating, treating them differently, persecuting, and domination of one race over the other. It's a very real issue that occurs that could put a wall up in communication between others. Bias, having a bias of one particular belief over another. You can't walk in saying my belief's better than your beliefs, or this one's a better one than that one, or you're going to already come in with a barrier. You're not going to be able to communicate with them. This could also be, say, I use the example on this one is that there are some people that are, I've got to use holistic medicine, holistic medicine, holistic medicine. And you've got somebody that comes in here and says, nope, I only believe in Western medicine, use of the medication. This could become a big barrier when somebody is trying to help a patient in a healthcare setting. Prejudice, forming an opinion or judgment before you know all the facts about the other person, meaning you don't really have all of the information before you start forming an opinion about somebody. Ethnocentrism is a belief that one's culture and traditions are better than those of another. That exactly what it means. It's saying mine's better than yours, or this culture believes this and this is better because this is what they believe versus this one. Stereotyping. Stereotyping is a belief that all individuals of a particular culture are exactly alike. That's saying that all girls that are 12 years old like to play dolls, or it's using the term all or always for one particular group of individuals without really knowing that there is differences. Healthcare rituals. This might mean how family is involved in patient healthcare. Some have the families very involved in the patient's care and some that are not. An example of this is when I'm working, there's a family that I would work at in our clinic, and we see this frequently with all the different therapists, is that in some cultures, you might see mom, dad, and the grandparents all coming in to therapy sessions. Well, that's normal in some cultures, and some it's not. So we as therapists have to acknowledge it and start work within that family's rituals, culture, to meet some kind of happy medium in our setting. Language is a huge barrier. Not only just language, it could be dialects within certain languages. There are multiple Spanish dialects that can be a barrier between each other. Find it happens all the time, and definitely use of interpreters or other translation services definitely tends to help us overcome that language barrier. Perceptions and expectations. Perceptions is more so perceiving things of a certain way, but more based on your senses: sight, vision, smell. Sight and vision, same, but smell, touch. I use this great example is that there was a picture trending on social media a while back, and you had a picture of a shoe, and I believe some people would see that shoe as pink and white, and some people saw that shoe as gray and green. There's perception differences. And if you think about that, think about how that can really affect each other when we're communicating, because we might both be looking at the same thing and see something completely different. Very important to remember that is a huge barrier. And just expectations. Sometimes we have an expectation of people being and acting or doing things in certain ways, and that could be a barrier when that might not be what the other person presents to you. So I provided you a list of some of the most common barriers that exist more so in healthcare that prevent us from providing appropriate patient care. But what's also important, these things also affect us in the coworkers that we're working with. And I don't like to leave that out, because it's really important, because in any type of office setting or any type of thing, these same things can become barriers to communicating and working collaboratively. So it's important to keep some of these things in mind. Two, that we have to understand what differences are around us. We have to know that between me and the next person, there's going to be a difference. So we need to accept what those differences are, whether we agree with it or not, and identify what are the barriers that keep us from communicating and providing us adequate patient care, or working with our coworkers when those barriers do exist. In some of the future lectures and some of the additional content, we're going to talk about how do we overcome some of these specific barriers with our coworkers and in patient care. So diversity is the one true thing that we have in common with each other. We must celebrate that diversity every day. Have a great day. I look forward to seeing you again.